My name is Kevin Brown. I'm a physician here at St. Peter's Health in the urology department, and we're here today in our office to talk a little bit about the urology services that we provide for the community. And so as a urologist, we treat conditions that involve the kidney, adrenal glands, bladder, prostate. We do a lot of men's and women's health and pelvic floor procedures to help with incontinence, erectile dysfunction, and we do all of that, both surgical and medical management. And so it's a great field because we get to do both the medical side, and we establish rapport with patients, and we get to follow patients for long times. And if they need a surgical procedure, we're able to do that as well. Anything from urologic cancers of the kidney, bladder, prostate. We also do kidney stones, voiding dysfunction, so enlarged prostates, urinary incontinence, erectile dysfunction. We do procedures for all of those. Some of the new things that we're bringing into the community, including the robotic surgery platform with the Vinci surgical instruments. So as a urologist, I use the robot to operate on kidneys, adrenal glands, bladders, and prostates. Robotic surgery has kind of developed over the last several decades, and it started out with one big robot, and it was initially designed by the military to be able to do surgery at the battlefield and having the surgeons kind of away at a safe location. And that technology has grown into what we have now, the Da Vinci surgical platform. And over the years, they've done a lot of upgrades and evolved in technology. And the newest robot is the Da Vinci Xi, which we have here at St. Peter's Health. And the biggest advantage that it gives us is that it has a much easier approach to setting the robot up, and it has more freedom for us to set up the instruments and perform our procedures. The vision is better, the tools are better, and overall it is a better operative experience for both the surgeon and the patient. And it's one of the only two in the state, so we're great and lucky to have it here and be able to provide services with the robot for the community here at St. Peter's. The great thing about the Da Vinci robot and having it here in the community is that it allows us to perform complex cancer procedures for patients who would normally have to travel distances and go out of the community to have the procedure performed. And it allows us to do this with great precision, and it makes the recovery for patients much easier and much quicker. People get a little bit nervous when they hear about robotic surgery, and they think that it's just a robot and the doctor's in the corner kind of taking a nap. But it's really just an extension of the surgeon's hand. It's similar to a scalpel or other surgical instrument. It's a robotic device that the surgeon is able to control, and it gives us magnified 3D vision so that we're able to see much clearer and identify structures that we normally wouldn't be able to. And then it gives us much more range of motion and freedom of movement when we're actually performing procedures, and it allows for minimally invasive approach to more technical surgeries. When we talk about minimally invasive, it's trying to do a procedure with the minimal amount of cutting or damage to structures. And so a typical surgery that we would perform without the robot would use an incision that's maybe 4 or 5 inches. Whereas with the robot, we can do that with several small incisions that are all less than 1 inch. The urology team here at St. Peter's Health, we're here, and we have a great office staff and great support from the hospital, and we're able to treat a wide variety of urologic problems. The best thing that we can do so that you don't have to come see us is drink plenty of water, make sure that you're staying hydrated, especially during the hot summer months or if you're being physically active and sweating. And then make sure that you're just regularly emptying your bladder and going to the bathroom. It's something that we tend to forget and put off, and a lot of times we end up tied up at work or in activities that prevent us from doing that, but people kind of disregard how important it is to kind of regularly go to the bathroom and stay hydrated.